Hello everyone. So today we'll start a new chapter, inflammation and repair. So this is part 1 of the same chapter. So first of all we will start with sequence of events in an inflammatory reaction. So before doing that we will see what exactly is inflammation. So inflammation is a response of vascularized tissue. So any tissue which has vascular supply, inflammation is its response, which will deliver leukocyte and molecules of host defense from the circulation to the site of infection. So that is why vascularization functions. From the circulation, leukocytes and some host defense molecules will come to site of infection or to site of cell damage, and it will cause a response known as inflammation. Inflammation is a silent killer because it may contribute to diabetes mellitus 2, Alzheimer's or cancer. Systemic inflammation is known as sepsis. And then what are the mediators of inflammation? Mediators are such compounds which can initiate or amplify inflammatory response and determine its pattern, severity and manifestations. So now let's see sequence in an inflammatory reaction. So what we can see here is a necrotic tissue and the microbes are coming inside it. So this macrophage, dendritic cell and mast cells have receptor on it to recognize the microbial product and substances released from the damaged cells. So we can see here microbes in orange color and the substances from the necrotic tissue in blue color. So this is the initiating stimulus which is recognized by tissue resident sentinel cells. So these are the tissue resident sentinel cells which are antigen presenting cells and first line of defense. Now these cells will secrete some mediators which will go to the blood vessel and start recruitment of leukocyte. In leukocyte, the major leukocytes that will come are monocyte and the granulocyte. So what will this monocyte do? Monocyte will be converted to macrophage, ingest the microbes and cause removal of the stimulus. Then what will the plasma protein do? Plasma protein will cause elimination of microbes and dead tissue, and afterwards there is vasodilation and increased vascular permeability which will lead to edema. Now when during this elimination some cytokines and growth factors are liberated which will stimulate fibroblast and extracellular matrix proteins and cell which will lead to repair. So repair is series of events that heal the damaged tissue. Repair can be defined as regeneration of surviving cells and filling of residual defects with the connective tissue, and this is known as scarring. So major components in this full sequence of inflammation was the blood vessel and the leukocyte. Inflammation is divided into acute and chronic inflammation. So we will start by discussing the difference between them. Onset of acute inflammation is fast, within minutes or hours of injury, and chronic inflammation takes days. So the major leukocyte in acute inflammation is neutrophils. In chronic inflammation it is monocytes or macrophage and lymphocyte. So this tissue injury. Tissue injury in acute inflammation is usually mild and self-limited. In chronic it is severe and progressive. And local and systemic signs in acute will be prominent, whereas it will be less in the chronic inflammation. Next we will see hallmark or the cardinal signs of acute inflammation. We see pain known as dolor, redness, rubor, swelling, tumor, heat, killer, and loss of function known as functio lisa. First 4 hallmarks were given by Celsius and the last was given by Virtue. Now let's see what are the causes of inflammation. We can divide the causes into 4 parts. One is the most common cause is infection, then we have tissue necrosis, we have foreign body and immune reactions or hypersensitivity reaction. So in infection, the outcome depends on the type of pathogen and the host response. And how does foreign body cause inflammation? By by themselves or by stimulating the tissue injury. So now, what are the cell receptors? We saw in the first flow chart that there were cell receptors. So on the plasma membrane we have extracellular cell receptors, then we have endosomal cell receptors which are ingested, and cytosol cell receptors which are intracellular. So these all receptors are present on the microbes. All receptors they see the microbe. Most common cell receptor are toll-like receptor. Leukocyte have cell receptor for the Fc tail and complement proteins which recognize opsonized microbes. Then we have complement system in inflammation, and also collectins. Collectins are the molecules which bind to and combat microbes. So now we will see a basic overview what happens when the cell is damaged. There is liberation of some molecules, or some molecules are altered, like uric acid, ATP, DNA, and then they are recognized by node-like receptors which are the cytosolic receptors. It will stimulate inflammasome, which is multi-protein cytosolic complex, which will stimulate production of cytokine interleukin 1. It will recruit leukocyte and cause inflammation. Sometimes there is gain of function mutation which leads to autoinflammatory syndrome. And in these autoinflammatory syndrome, what do? We give IL-1 antagonist so that this inflammation can be reduced. So this was a basic overview of inflammation. We'll discuss acute inflammation in the next part of the chapter.